Hi, I'm Daniel Lin. I'm a GI medical oncologist at Thomas Jefferson University Hospital in Philadelphia. For this year's ASCO Direct Philadelphia, I reviewed key non-colorectal GI cancer abstracts discussed at ASCO 2021. So first, there's been a lot going on in the esophagogastric cancer space. So starting with CheckMate 648, this was a study which compared nivolumab plus chemotherapy, in this case, fluoropyrimidine and platinum-based chemotherapy versus nivolumab plus ipilimumab versus chemotherapy by itself as frontline treatment for advanced metastatic unresectable esophageal squamous cell carcinoma. So the data here showed us that nivolumab plus chemotherapy improved progression-free and overall survival with more benefit, in particular for those who are PD-L1 positive. Though of note, this study used the TPS and not the CPS PD-L1 scoring, which is more standard for esophagogastric cancers. But overall, nivolumab plus chemotherapy is a potential first-line option for esophageal squamous cell carcinoma patients, pending FDA approval. Now, for the nivolumab plus ipilimumab arm in CheckMate 648, there was improvement in overall survival, but not progression-free survival. So a completely chemo-free arm is intriguing and may be beneficial in certain patients, but currently there's no clear phenotypic or molecular profile upfront, which helps us to discern those patients who may benefit the most from nivo-ipi and not from chemotherapy. Moving along to Keynote 811. So this was a study looking at HER2-positive metastatic gastric or G-junction adenocarcinoma. And patients were randomized to receive either fluoropyrimidine platinum chemotherapy plus trastuzumab with or without pembrolizumab. So this was a first interim analysis focusing on overall response rate. And what we saw was that overall response rate was very impressively increased from 52% to nearly 75% in the pembrolizumab arm. The survival data is currently still pending for that trial, but as of now, pembrolizumab plus chemotherapy and trastuzumab is FDA approved for frontline regimen use for HER2-positive metastatic gastric and G-junction adenocarcinoma. Finally, with esophagogastric cancers, there was CheckMate 577, which was an adjuvant study. So recall that this study looked at the role of postoperative nivolumab after neoadjuvant chemoradiation followed by surgery. And so essentially, prior to this study, the standard of care had been observation. So with CheckMate 577, we saw an impressive doubling of disease-free survival from 11 to 22 months with the addition of nivolumab, improved distant metastasis-free survival, as well as progression-free survival too in the updated data. And most importantly, there was maintenance of quality of life on nivolumab compared with observation. So adjuvant nivolumab is now a standard of care following neoadjuvant chemoradiation and surgery for esophageal and G-junction cancers. So shifting gears next to biliary cancers. So the NIFTY trial was highlighted. This was a second-line study for patients with biliary cancer post-progression on first-line gemcitabine and cisplatin. And patients were randomized to receive either 5-FU leucovorin or 5-FU leucovorin and nanoliposomal irinotecan or Biliary. So 5-FU Biliary did improve progression-free and overall survival in this study, as well as response rate compared with 5-FU alone, and without a significant apparent decrement in quality of life. So 5-FU Biliary should be considered a standard second-line option for patients post-gemcitabine cisplatin in advanced biliary cancers. And just as an aside, what should also be standard for all biliary cancer patients is comprehensive genomic testing to search for actionable targets such as IDH1 and FGFR, for which there are clinically meaningful targeted treatments. Finally, for advanced hepatocellular cancer, so there was the FOHIC-1 study. So this was a study investigating the role of hepatic arterial infusion chemotherapy with FOLFOX or HIC-FOLFOX versus sorafenib in the frontline setting for untreated advanced HCC with large intrahepatic tumor burden. So what we saw in this study was an improvement in response rate as well as overall survival with HIC-FOLFOX, particularly for those patients with main portal vein and large intrahepatic tumor burden. However, it's overall unclear what to make of this in the era of atezolizumab and bevacizumab being the frontline standard treatment per EMBRAVE 150 and not sorafenib, as well as its broader applicability in the non-Asian population, and also within the context of an expanding treatment landscape for HCC. So those are my GI non-colorectal cancer highlights for ASCO 2021. Thanks for listening.